Hi everyone, for today's topic it's all about stroke. But before I start my topic, please guys help me with my channel to please like, share, and subscribe. A stroke is a sudden interruption in the blood supply of the brain. Most strokes are caused by an abrupt blockage of arteries leading to brain or the ischemic stroke. Other strokes are caused by bleeding into brain tissue when a blood vessel bursts or the hemorrhagic stroke. Because strokes occur rapidly and requires immediate treatment, stroke is also called brain attack. When the symptoms of a stroke last only a short time or less than an hour, this is called a transient ischemic attack or the TIA or the mini stroke. The effects of stroke depend on which part of the brain is injured and how severely it is injured. Strokes may cause sudden weakness, loss of sensation, or difficulty with speaking, seeing, or walking. Since different parts of the brain control different areas and functions, it is usually the area immediately surrounding the stroke that is affected. Sometimes, people with a stroke have a headache, but stroke can also be completely painless. It is very important to recognize the warning signs of stroke and get immediate medical attention if they occur. Types of stroke. 1. Ischemic stroke. The most common type of stroke, accounting for almost 80% of all strokes. It is caused by a clot or other blockage within an artery leading to the brain. What causes it? Ischemic stroke can be caused by several different kinds of diseases. The most common problem is narrowing of arteries in the neck and head. This is most often caused by atherosclerosis or gradual cholesterol disposition. If the arteries become too narrow, blood cells may collect and form blood clots. These blood clots can block the artery where they are formed, thrombosis, or can dislodge and become trapped in the arteries closer to the brain, or embolism. Another cause of stroke is blood clots in the heart, which can occur as a result of irregular heartbeat, for example, atrial fibrillation, heart attack, or abnormalities in the heart valves. While these are the most common causes of ischemic stroke, there are many possible causes. Examples include use of street drugs, traumatic injury to the blood vessels of the neck, or disorders of blood clotting. 2. Intracerebral hemorrhage. An intracerebral hemorrhage is a type of stroke caused by the sudden rupture of an artery within the brain. Blood is then released into brain, compressing brain structures. What causes it? The most common cause of intracerebral hemorrhage is high blood pressure or the hypertension. Since high blood pressure by itself often causes no symptoms, many people with intracranial hemorrhage are not aware that they have high blood pressure or that it needs to be treated. Less common causes of intracerebral hemorrhage include trauma, infections, tumors, blood clotting deficiencies, and abnormalities in blood vessels such as arteriovenous malformations. Who gets it? Intracerebral hemorrhage, coronal edema, a ruptured blood vessel will leak blood into the brain, eventually causing the brain to compress due to added amount of fluid. Intracerebral hemorrhage occurs at all ages. The average age is lower than for ischemic stroke, less common than ischemic strokes. Hemorrhagic strokes make up about 12% of all strokes. 3. Subarachnoid hemorrhage. A subarachnoid hemorrhage is also a type of stroke caused by a sudden rupture. A subarachnoid hemorrhage differs from an intracerebral hemorrhage in that the location of the rupture leads to blood filling the space in the brain rather than the side of it. What causes it? Subarachnoid hemorrhage is most often caused by abnormalities of the arteries at the base of the brain, called cerebral aneurysms. These are small areas of rounded or irregular swellings in the arteries. Where the swelling is most severe, the blood vessel wall becomes weak and prone to rupture. Who gets it? The cause of cerebral aneurysm is unknown. They may develop from birth or in childhood and grow very slowly. Some people have multiple aneurysms. Subarachnoid hemorrhage can occur at any age, including in teenagers and young adults, and is slightly more common in women than men. 5 warning signs of stroke. 1. Sudden numbness or weakness in the face, arm or leg, especially in one side of the body. 2. Sudden confusion or trouble speaking or understanding speech. 3. Sudden vision problems in one or both eyes. 4. Sudden difficulty walking or dizziness, loss of balance or problems in coordination. 5. Severe headache with no known cause. What time of the day do most strokes occur? Strokes are more likely to occur during 2 3-hour periods, one in the morning and the other in the evening. Research suggests. Japanese scientists who examined 12,957 cases found the risk peaked between 6 a.m. and 8 a.m. and 6 p.m. and 8 p.m. Risk was lowest during sleep. What happens immediately after a stroke? Numbness, weakness, or paralysis on one side of your body, slurred speech, or difficulty finding words or understanding speech, sudden blurred vision or loss of sight, confusion or unsteadiness, or a sudden severe headache. Recovery people have stroke will make a good recovery quite quickly. Can you live a normal life after stroke? There's a life after stroke, but it is also one of the leading causes of disability because more than 80% of people who have a stroke survive. Survivors often face physical, emotional, or cognitive challenges as a result, but one of the health stroke neurologists says there is life after stroke. What is the best exercise after a stroke? The guidelines recommend that stroke survivors engage in 20 to 60 minutes of aerobic exercise such as walking 3 to 7 days per week. The exercise can be done in 10-minute intervals with the goal being at least 20 minutes per day. Is it normal to sleep a lot after a stroke? In the first weeks and months after your stroke, your brain and body are healing. The recovery process takes up a lot of energy, so it is normal to feel very tired. Physical problems will also mean that your energy is being used in different ways. Can you stop a stroke once it starts? Note the time you first see symptoms. A clot-busting medication called TPA or tissue plasminogen activator can be given to someone if they're having a stroke, potentially reversing or stopping symptoms from developing. It has to be given within 4.5 hours of the start of symptoms. Thanks for watching. Please like, share, and subscribe.